Pedophilia OCD is the third subset of OCD in which, once again, our emotions are an integral part of trying to discern whether we have a problem or not. So a person might look at a child and find that child to be pretty, or find that child to potentially even be sexually arousing. And then the person becomes highly distressed at the idea that if I see a child as attractive, that might mean I'm at risk to harming that child. So pedophile OCD involves often one of two subsets, where a person is afraid that they might act out on that attraction and that children around them may not be safe, or the idea that their character is indicted for having any thoughts about children in any way that might be sexual or attractive. The idea that, okay, I know I'm not going to act on it, but just thinking of children in a sexual way might implicate me as being a deranged, twisted freak. And so they become preoccupied at trying to save their identity through proving that they do not find children attractive. One of the most common questions that patients ask me who have pedophile OCD is, how do they know that they're not actually a pedophile? And it's not at all a difficult question to answer, because a pedophile sees children's sexual nature in a very positive and appealing way, where they engage in a great deal of conspiring to find ways of being with children in a sexual way. Persons with pedophile OCD are exactly the opposite. They have associations regarding children in a sexual way, but then react to those associations as if they're a moral criminal, and are desperately trying to prove whether they're guilty or not, and they're desperately trying to work on making sure that they would never act in such a way. Persons with POCD often have a misconception that any person under the age of 18 should never be seen in a sexual way. And so they become very preoccupied with either the morality or legality of finding a person below the age of 18 in any way attractive or sexual. And obviously, children can be seen as sexual. There's this show, Toddlers and Tiaras, where parents dress up 8-year-olds in a way that's very provocative. Teenage girls can dress in a very provocative way. And so finding these children to be sexual in any way for people with OCD generates a tremendous guilt response or distress that something unhealthy and unusual is happening. Those who might be familiar with someone who has pedophile OCD would want to treat the topic with a great deal of lightness and a lack of relevance. There's nothing about the topic that has any significance or meaning other than that the sufferer's brain has teamed up an energy of distress and threat with this, very taboo topic. So to be able to joke about it, to engage in light banter, to encourage, open, transparent disclosure, to really kind of take the skeleton out of the closet, as it were, is a very, very powerful means of working with someone with this type of OCD, so that by not keeping it secret, not pretending as if there's something legitimately problematic, it can be, very much an adjunct to the treatment goal, which is, the irrelevance of the signal emotionally and the irrelevance of the topic. So treatment for pedophile OCD is not too dissimilar as it might be for any other form of OCD regarding using exposure and response prevention. We might have patients purposely noticing children on the street, or noticing children on television programs, or even bringing up pictures of attractive little children online and having them engage in a purposeful viewing of these pictures or noticing of these kids, and actually encouraging one's own brain to have a sexual response. It's sort of a, once again, paradoxical way to kind of show that the person is now declaring this question to be meaningless and not relevant to their concerns authentically. Someone with pedophile OCD in recovery would be able to notice children being attractive, even finding some sexual nature in a child under the age of 18, and not react as if their whole world were collapsing around them. They would go about their natural day, not avoiding the beach, not avoiding children's events like a bat mitzvah or a confirmation, and to really fully participate in living and accept their brain's creativity if it has associations about children as being attractive.